While I appreciate the heartfelt words of many here about the sacrifice, I just simply think of the 13,000 children who will not receive mental health care as a result of this bill. And I'm just wondering which of the 13,000 you're willing to sacrifice, because that's really what I think this is all about. At the end of the day, there'll be 13,000 kids who were getting mental health services that won't get mental health services given the commissioner's own numbers in this bill. That's a lot of kids, if you ask me. This is going to impact not just health care numbers. This is going to impact education, because about 8,400 of those kids are in school. And I don't know if tomorrow we're going to be doing, I believe, E12 education, and maybe we ought to really have to bump up the number then, because special education is going to need some help, because we've taken some of the funding that was helping these kids be ready for school and be able to prepare, be able to handle school. So maybe we need to be bumping those numbers up. There's 4,200 kids in the child welfare system who aren't going to get services. Those are kids that are already at the margins. And those kids are going to, once again, I will use my favorite phrase, it's pay me now or pay me later. We don't treat those kids, and I've worked with those kids before. When they haven't gotten treatment, they end up as guests of the state. At a much higher cost than we're talking here. $93 a day if they're working in crisis. I think that's, that's short-term money in comparison with what we'll spend over the years in social service benefits, trying to keep them off the streets and trying to keep them out of jail. I can tell you that my colleagues from my prior profession don't support this bill. I've gotten calls from the CIT trained group, which work primarily in the two big cities, but I think there's more of them than that all over the state of Minnesota. They're the crisis intervention teams. They're the officers who really, other than mental health professionals, are that first responder that goes out and deals with somebody that's completely in distress, who's out of control. The CIT program has saved lives. And the officers that work in that program are alarmed at the fact that crisis teams and mental health professionals won't be available given this bill to go out and assist them. It's a pay me now, pay me later. I recognize that, yeah, we have big budget problems. I don't dispute that whatsoever. But what I see this bill doing is simply shifting those budget problems to other parts of the system, whether it's to law enforcement, corrections, or education. And I oppose this bill.